Thank you for having me. Wow, it's quite a day. I'm sorry I wasn't able to actually attend yesterday. I was traveling, so I was in transit coming back from Europe. But today's really been an interesting day. This is hard to close with all the great speakers that we've heard so far, and really a lot of insightful stuff and just impressive thought in a lot of the presentations today. And I'll probably reference a couple of those as I talk about digital transformation. And when I talk about and use the term digital transformation, I think it's slightly different than what we all look at in terms of disruption. So I'm not sure healthcare is going to see a huge disruption in a short period of time, but I do think that we'll see what we call digital transformation. And I do think that a lot of you folks are actually leading that. So when we look at the paradigm shifts that are happening and how technology is evolving, I think a lot of you folks are leading the way. So I'm going to bring up some stats. I actually work on a worldwide team at Microsoft, so we actually focus globally. So I get to see things in many different markets. Some of those are mature, some not so much, but they all have similar challenges and similar things that they need to solve for. I do think it's interesting, you look at the cost of healthcare. Globally, we're looking at about a 10.5% GDP. In the US, we know we're at almost twice that. So again, huge opportunity in terms of cost and controlling cost. Excuse me, I have a cold, so I'm struggling a little bit with my voice. And also just things like worldwide shortage of healthcare workers. Estimates are that there'll be 14 million in terms of shortage. And again, there was some debate on that today on whether that's true or not, but I think we all know that potentially technology can be used to solve for some of these problems. Just one thing that I just wanted to touch on, everybody here, most of you are in healthcare, work in healthcare, are clinicians. You know, we always talk about quality, access, and cost. And recently, there was some shift in this too, to also talk about productivity. The only reason I bring that up is actually that's the area that I focus on for Microsoft. So I actually focus on how we can use productivity tools to actually help people with efficiency, cost, quality, and those types of things. So when we look at digital transformation, really what we're seeing today, and this is no secret to anybody, is we're basically seeing a rapid decline of inpatient care, okay? And if you look at this, and you look at the decline over time, you'll actually see that it's going to continue to accelerate, where we're going to see that decline over time. But here's what's interesting. It actually provides a new opportunity. And so when we look at where healthcare is going, there's really three big areas. There's this area of population health. So instead of being reactive, how do we be more proactive in managing populations? There's this area that you're all here for today, the area of virtual health. So how do we do things virtually? And it is, yes, it's voice and video visits, but there's also a lot of other things that you can do in terms of virtual visits and virtual health, and I'll talk a little bit about that. And then there is this area of precision medicine. So whether it's genomics, whether it's clinical analytics, or even customer or product analytics, there's a lot going on in this analytics space and what can be done there. So when you look at this though, the current market today has traditionally been very focused on global health platforms, as well as fragmented systems of record. So like EMRs, imaging, case management, those types of solutions. I think what all of you folks are focused on is the next generation of systems. And these are systems that provide insight and also provide engagement. So really shifting from that classic approach of systems of record to systems of insight and systems of engagement. So when we talk about the evolution of health solutions, we are really evolving now from these systems of record into these systems of insight and systems of engagement. By the way, systems of insight and systems of engagement, excuse me, they're not necessarily evolving one after the other. We're seeing evolution in both areas, but that's really where the market's shifting to. Sorry. And so really when we look at the old patient paradigm, you know, we're looking at this traditional cycle of, hey, somebody feels bad, they go see the doctor, they go to the hospital, they give information, they receive treatment, they recover. And then maybe there's a lapse of time before they go and do anything again, but there's nothing that's continuous, that's proactive, that's trying to be preventive, right? And so the old patient paradigm is reactive, it's disconnected, and it's cyclical. The new patient paradigm is really around what is, you know, things like a proactive wellness plan, personalized treatments, connected consumers, remote monitoring, connected devices, and connected care partners. Okay, so again, we're evolving in this market. So the really cool thing is you folks are trying to, maybe you want to use the term disruption, but at a minimum, we're digitally transforming healthcare. And there's many different ways that we can go and do that. And so a lot of discussion this week around things like virtual health, but also you're hearing from other organizations that are doing things like remote patient monitoring or some type of analytics maybe, or mobile care workers. So how do we help care workers that actually don't sit at a desk all day? They're actually moving around doing a lot of different things. And so there's a lot of different examples and a lot of different solutions that are out there that focus on these areas. Just a couple that I want to talk about today. One was actually demoed this morning, so I was actually quite pleased that Health Navigator and Amy actually showed you what we're doing around these health agents or these health bots. Just one other thing to point out too, Dr. Newell this morning talked about the competition in 10 years. And he said that Microsoft, Google, Amazon, I think he mentioned maybe Facebook, were going to be the competition. I just want to be clear that Microsoft does not want to be your competition. We don't want to come into this space and actually provide these solutions. We want to work with the industry to provide these types of solutions. So we do think we can bring technology to the table, but we know we're going to need to be in partnership with the industry to actually make these technologies real. So a great example this morning was actually demonstrated to you where you have someone like Health Navigator who has really good, well thought out decision workflows that they've built up over time, where they can not only focus on the clinician to patient or workflows for the patient, but also in the clinical area. And so that's a great example where we can leverage our bot framework technology, and we can actually work with partners like that to improve those types of workflows. And so when you think about a bot framework, it's natural language processing, it's multi-turn conversations, and it's really any endpoint. So she showed it to you in Skype, but you could run it on a mobile device, you could run it in a browser, you could really use it, you could also do speech or text. So you have a lot of capability to take this and leverage it in many different vehicles. And again, any endpoint and any API. What's also interesting though is when you start to integrate other things into it. So there's a bunch of other knowledge that's available freely out there. So it may know things like if you have some type of a personal health record or you have an integration with something like an EHR, it may know your medications as you're talking to it. So it may be able to make better decisions based on the information that's being fed to it. Sometimes just knowing your location. One of the things it will do is if it actually has access to your calendar, it may see that you recently traveled a long distance. Well, that can actually impact individuals' health, if they have issues with DVT or something like that. So again, knowing those other data points or those inputs are important. And then there's things like personal health records, even wearable data, okay? And then we're also looking at how we can integrate that with third-party data and customer data, as well as even things like service provider lookup and scheduling. So again, just using a bot to say, hey, I want to make an appointment, it's showing you what the available times are, you tell it what date and time you want, and it actually schedules the appointment for you. Another area is analytics. When we talk about analytics, there's a lot of different areas and a lot of R&D that's going into this particular area with a lot of different organizations. But there's different types of analytics. So the first one is real-time and predictive analytics. So how do we do things in real time or do things that support predicting particular outcomes. There's self-service analytics. So another big challenge with analytics today is the analytics tools may be great, but a lot of times they're not usable by end users. So how do you make those tools intuitive enough or easy enough for end users to actually use and leverage? There's things like the Internet of Things. So again, connecting to different devices and getting that continual input from those different devices. And then obviously in cloud analytics, so to erase historical boundaries for data. I mean, so with the clouds that are available today, literally you can spin up hundreds or even some cases thousands of virtual machines to do processing on things that may have taken weeks or months before can be done in actually minutes or hours now today. And we have some great examples. We actually have a healthcare provider in Madrid that actually uses it for genome sequencing. So they literally serve up for individual patients the genome sequencing into the cloud, comes back down, and they actually use it to treat cancer patients. And so when we look at this concept of analytics, it's really about predicting and responding proactively. And it just goes through that process of what happened, why did it happen, what's going to happen, and what should I do? So descriptive, diagnostic, predictive, and prescriptive. And that allows you to hopefully get into what we call actionable insight. Now, people are talking about, well, are these computers going to replace individuals? I don't think that's going to happen in any time soon. Maybe at some point it'll be able to get better, and it'll actually allow clinicians to really focus on the severe cases or the things that they really should or need to focus on. But again, these tools could be useful in a lot of different ways to kind of support some of those conversations and those decisions. So what I want to do next is I actually just want to show a couple of videos that kind of talk about some of these things and what's happening. The first one that I want to show is actually something that's happening today, and it's at Children's Mercy in Kansas City. And it just shows how you can basically start with an idea, you can take some technology and apply it, and really see what you can do to make a difference. The second video that I'm actually going to show is a little more forward thinking, but I always think it's good to have a vision on where you want to go, because it kind of helps you kind of map things or try and decide what decisions you want to make or what things you want to focus on so you can make that vision a reality.
I think in the back of each of our minds we were planning a little funeral, and just didn't know where it would go after he was born. Winston was diagnosed with HLHS, which is hypoplastic left heart syndrome.
1 in 100 to about 125 babies are born with heart disease every year, and out of those, about 1% are born with half a heart. Out of all the heart surgery we do, this is the most high risk.
They lose about 25% of these babies in between the two surgeries.
The standard of care at the time was to send these families home with a weighing scale and a pulse oximeter and a 3-ring binder, and they were asked to record measurements of their baby every day.
There would have been a lot to juggle and learn on our end, just as new parents. And then we added all these things in that really increased the stress level.
So we needed a method that we could actually send something home with the parents so that we could better monitor and be alerted if there were conditions that we were concerned about with the patient. We have a Microsoft Surface that we load our software on. We call it CHAMP. We decided we wanted to use a modern app with Windows 10 as the operating system.
We would log all of his vitals, and that app became this seamless piece to his care.
With the daily reports that come in from the Azure cloud, if anything is an outlier that needs to be notified to us immediately, it'll alert us.
The tablet already has a camera, and we said, why not get video every day in addition to all the other measurements? Just see what that does.
One of the things that saved Winston's life was the 15-second video.
When we were looking at his information, he had a couple days of not gaining weight. He was breathing a little bit harder, and he just wasn't happy on his video.
They could pull it from when he was doing fine and saying, okay, a couple weeks ago, this is what he looked like. Now he looks like this. We think it is part of his aorta.
They did the procedure the next day, and then I think he went home the day after.
There's still that underlying piece on the back of your mind. You're going, this is major heart surgery.
I mean, it's a scary thing to think of what could have happened.
This technology literally saved his life.
The first time that I heard a child's life had been saved with Champ, I left the room because I kind of needed to tear up in private because it was a dream that I had had for a long, long time.
We've learned so much, and it's changed our practice and made us more efficient, but also saved lives, that we want to roll out nationally to other children's hospitals that do cardiac surgery.
For everyone behind the scenes, we're very thankful for it. It saved his life, and how do you say thank you for that?
So it's a great story, and what I love about that story is they had an idea and they just went and figured it out. And what's really cool about that is I think you might have heard her say between the first and the second surgeries, they would typically lose about 25% of those patients. They've only lost one patient since they've implemented this system. So a huge improvement in outcomes. But again, just looking at how can I take technology and apply it. And it wasn't this big sophisticated thing. They didn't wait for some vendor to come to them with the solution. They just went and figured it out. And so I applaud all of you in the room because you're trying to make this change. And that's exactly the kind of stuff that needs to happen for this digital transformation. So the second video that I'm going to show you is a little more futuristic. May not be 100% accurate either, but I think it just hopefully inspires you to think about how technology can be used. All of the technology in the video is actually something that's either in market or that's something that will be in market in the not too distant future. So again, just another approach. Thank you. Questions?
How did you get Michelle Obama to play the doctor?
I couldn't tell you where they found her. Sorry. Yeah. It does look like her, though, doesn't it?
Thank you. This is a nice show and nice presentation. There's one question always in my mind when I try to do some telemedicine. A lot of technical people thinking how to present the advanced technology, trying to implement it in the resolve the issue. However, reverse way, we haven't really think about it. What is really the demand? What is really the people demand? When I was working with my fellow in the senior house, just we drive there and we'll ask, they'll say, okay, this is 80 years old, they should be do this way, should be do this way. When we're talking this way, actually, we are 50 years old. We're thinking 80 years old. Just like we are talking to our children, they are 16 years old, they said, Dad, we are different. So all this technology actually is really trying to let the society to use it. But right now, the different society, different culture, different economics really completely diversified. And how the Microsoft leading and trying to find the fit position and the fit technology really implemented in the different.
So I think part of that is one technology doesn't solve for all individuals. That you have to look at the use of the technology even by age. So I do think there's applicability. There are some people who may never use it just because they don't want to use the technology. But I do think you absolutely need to look at what the technology format is for the different age groups. I also think that Microsoft does invest a lot in accessibility. So we're always looking for different ways to use technology to benefit individuals. So I think the last thing I'd say is my parents are in their 80s. And my dad loves his iPad, so I do think we do have 80-year-olds that use tech. But he's not like the most technical savvy person on the world, but he's figured out how to use an iPad, right? So in that example, doing a virtual visit on an iPad, just might make sense, right? And yes, I work for Microsoft, and yes, I did say iPad.
My mom never used iPhone.
Okay.
But my dad used iPhone.
There you go.
When I give them the telerobotic, my mom asked me one question: is that too complicated? I said, no. Do you know how to turn the TV on? She said, yes. I said, this is better than TV.
Yeah.
You don't need to turn on. Just
exactly.
Thank you very much. Those very moving videos you showed us. I don't know if my question is directly related to what you presented today, but it's maybe more futuristic. We're hearing more about DNA computing, and do you think that in future we would be able to have implantable DNA chips which can stream the data to devices outside and go over there? And if is Microsoft looking at something like that?
Boy, that's really beyond my, the thing about Microsoft is it's a really large company, and we do a lot in R&D. I mean, literally, we're spending billions annually. So one of the challenges in working for a company like Microsoft is staying up to date on everything that they do. Personally, I don't focus on the analytics or the cloud computing, the DNA stuff, all of that. So I'm probably not the best person to ask. There might be some in the room who follow that more closely. We have some really intelligent people in the room. They might be able to give you a better answer to that question.
So I love that presentation. The second half was just phenomenal and so exciting, and just gets me excited. But I want to go back to your first half, which is talking about the use of data to create a new paradigm, looking at preventive care, and a lot of that vision requires access to diverse data sets. So you did mention LPs, so they can be unstructured data sets, but it's accessing them that's the challenge. Two questions. One is, where do you think the data access is going to go? And secondly, are you looking at bots that leave the data in situ or have to abstract it into the cloud, process it, and bring it back out? How are you planning to correlate all those data points to give you the answer about when to make my appointment? Yeah,
so in terms of, one of the challenges in healthcare that I know everyone struggles with and everyone's all aware of is fragmentation is incredible, right? And so we do have, and again, I'm not the data analytics person. There's an individual on my team that actually focuses on that. but we do have the ability to bring together multiple data sets. So we do a lot of work in that where you can actually pull together multiple data sets and then you can find the links for those data sets and actually do some pretty interesting things in the cloud. So that's one thing. I think those systems of record are going to be here for a while. At some point, some of the digital transformation stuff that happens on the high end is probably going to come back down and capture some of that as well. Because I think, somebody made a comment earlier that was one of the biggest challenges is, hey, I want to do telehealth, but I want to tie into my EMR or my EHR, and some vendors are better at allowing people to do that than others. And I also wouldn't look for the EHR vendors to necessarily be the innovators. I'm not saying all won't, but most of them aren't going to be the innovators. They kind of want to do it at their pace and kind of extend the systems from there. So I do think over time, though, there is a lot of thought to how do we bring together data from multiple sets and then link it in a way where it's insightful or meaningful. So I definitely think we'll see some improvements there. But there's some really, I'd love to connect you with my analytics person, and he can talk to you about some of the stuff that they've done and how you can bring that together and do some pretty cool stuff.
So we were just at the TechCrunch hackathon, and we built a computer vision for facial tracking, and we uploaded data to Microsoft Azure for sentiment analysis for real-time emotion. And then we realized there's multiple APIs because Amazon have the recognition, and then Google have the emotion API, and then of course the Microsoft, and then there's also OpenCV. So as a company who's focusing on not only improve physical health, but also emotional health through teledance, I'm very curious to see, and mental health has become a much bigger problem now. I guess a lot more focus now in you not only need to keep the patient physically healthy, you also need to keep them mentally healthy. And so I'm kind of curious about you guys' focus, especially on mental health, emotional health. And then the second question is, as a startup, when we look at the data, the storage eventually will be charged by each image uploaded, and then in an hour you can upload tons of images to the server. I mean, do you guys offer any kind of programs that make it more affordable for startups?
Yeah, specifically to the programs, I guess I'd have to kind of follow up with you on that. We do have some programs that help startups, but again, it depends on where you're at and what your requirements are. So yeah, let's take that offline and I'll see if I can plug you in. As far as the sentiment analysis, again, it's not something I personally focus on, or it's not my focus area, so I'm not as familiar with what's going on there, but I do know that we're looking at those kind of things. It's kind of interesting though, because even doing some of that recognition around imaging and stuff, it's getting better, but even there's some challenges around that kind of stuff. But I think, what's interesting is a lot of the big tech companies are focusing on it. So I definitely think we'll see some interesting changes there over the coming years.
In the past, I've utilized Microsoft Azure to create a virtual practice and encourage patients to take ownership of their personal health records through Microsoft Health Vault. Just want to know, what's the utilization rate? Is that, I'm just curious about that, because I've had difficulty in the past. Yeah.
So I can't go into detail. There's going to be some announcements coming out about Health Vault. So just for anyone in the room who's not familiar, there was a product that Microsoft launched about 8 years ago called Health Vault. It was intended to be a personal health platform basically for organizations, for companies, or whoever, or individuals to store personal health information. It was really intended that the individual actually owns the information, but then others can connect to it. I think there's like 360 medical devices that were connected to it. There were some applications that were built on top of it. It was built before what we consider the cloud today. Microsoft launched it in a couple of markets, but probably the business model probably wasn't where it needed to be. The good thing is Satya actually recognized that it was an asset, So he asked a team in research to go and look at it and figure out what we need to do with it. So I think probably within the next 6 to 9 months, you're going to hear some announcements about Health Vault and how we're going to try and move that forward. But again, that's a great example where it will be a platform. So the intent is for it to be a platform, and then for companies, for healthcare providers, whoever, if they're looking for a place to store personal health information, they'll have that capability. So hopefully you hear about some good things here. But for example, this morning in the Navigator, she actually showed you in the demo where it actually interfaced with Health Vault. So because it knows who you are as an individual, if you have information in the Health Vault, it'll actually use that to triage the conversation that you're doing in the bot.
Thank you so much. Any other final questions? And then maybe Paul, I could ask you a final question right close up. So I mean, you have worked with physician to big healthcare system. I'm using a lot in the entire industry. Like, what is something that you believe in from your experience, for the things I've seen, that the rest of the world doesn't believe in yet?
Doesn't believe in? Oh man, that's a hard question. That the rest of the world doesn't believe in? Well, one of the things I don't think everyone really believes yet, and but Dr. Newell this morning when he made the comment about competition in this industry in the next 10 years, I don't think it's going to be I do agree with some of what he said. I don't think it's going to be the same competition you see today. I still think there's a great opportunity for startups and companies to get in this industry and do something that's very transformative. But there's a lot of money being thrown at this industry. I think I heard something, Milton, maybe you heard it too, a couple of weeks ago, that $16 billion has been invested in this industry since 2014. Was it something? Yeah. Yeah, which is a pretty significant amount of money. And I can also tell you that most of the major technology companies are very interested in this space. If you watch the news, they're probably not telling you everything that they're going to go do. But I can tell you pretty much all of Microsoft's competitors are investing heavily in this space right now. So I do think we're going to see some interesting stuff just because of the energy. But at the end of the day, I actually think individuals from the industry are the ones that are going to make the difference or change it. A lot of companies, including Microsoft, have tried to come into this space and kind of come to the market with their own thing. And it's hard. It's really hard. And I've been in the industry my whole career. And I don't think one company's just going to come in and do something that's disruptive. So I think the key thing is, back to your question about what is it that maybe a lot of people don't see, I think platforms are going to change this industry at some point, just like they've disrupted other industries. So if you think about companies like Uber, Uber disrupted because of the platform. If you look at what Uber did, if they tried to do that 5, 6, 7, 8 years earlier, they would have never been able to do that because there were not platforms in place to allow them to actually disrupt. I don't think healthcare is going to see the Uber disruption, but I do think platforms are going to definitely transform this industry at some point. It's just a matter of when.
Amazing insight. Thank you so much, Paul.
Thanks.